Hello and welcome to Bank. Today we are going to break down classic high-yield OBGYN questions from the USMLE step to QBank. This is a topic that students often find confusing, managing the stage of labor, when you should intervene, and when you should just wait. By the end of this video, you will confidently know the answer, and I will give you a powerful mnemonic that will lock this concept in your memory for exam day. Okay, let's look at our first slide. We have a case vignette. I will read it out loud and I want you to focus on the key numbers and facts. The case says a 32 years old woman, gravida 2 para 1 at 40-week gestations, admitted to the hospital. She has having spontaneous rupture of membrane and regular painful contraction. This is sign of true labor. This is a pregnancy has been uncomplicated, but her last pregnancy result in an operative vaginal delivery for a non-assuring fetal status. The patient has no chronic medical conditions and no prior surgeries. Her digital cervical examinations since admission are shown below. So, look at labor curve. What you see. At 6 hours, she is to 6 cm dilated. Look, at 6 hours, she has a 6 cm dilated. Now, at the 8 hours, she has progressed to the 8 cm dilated. Let's look at the other vital information. Her vital signs are normal. The fetal heart rate monitoring is category 1, which is perfect. It means baby is not in distress. The baseline rate about 110 to 160 beats per minute. And good variability, no deceleration. This is mean by category 1. And the Toko dynamometer show contraction every 2 to 3 minutes, which is good, normal frequency. So the questions ask, which of the following is the best next step in the management of this patient? Pause the video for 1 minute and choose the answer. Now, alright, the correct answer is B, expectant management only. Now let's understand why this is correct by first eliminating the wrong choices. Why not A, cesarean section? A C-section is a major surgery. It's indicated for issues like an active phase labor arrest or category 3 fetal heart rate tracing. Our patient progressing beautifully and the baby is fine, so C-section is far too aggressive. Why not C and E? Intrauterine pressure catheters measure the strength of the contraction, and oxytocin make them stronger. We consider these for labor protection, meaning when labor slow down to less than 1 cm every 2 hours, our patient is progressive at 1 cm per hour, which is excellent. Her contractions are adequate, so she does not need this. And why not operative vaginal delivery? This means using forceps or vacuum to help deliver the baby. This is only option during second stage of labor, which is from 10 cm dilation until delivery. Our patient is only at 8 cm dilated, so she is still in the first stage. This leaves us with one only correct option, expectant management. So moving to the second slide. This question is all about active phase of labor, which is start at 6 cm and goes to the 10 cm. Our patient is at 8 cm, so she is clearly in active phase. The rule for normal progress is simply dilation of at least 1 centimeter every 2 hours. Our patient went from 6 cm to 8 cm in just 2 hours because she is progressing normally and the baby reassuring, category 1 tracing. We do not need to intervene. Now, let's look at our mnemonic to make sure you never forget this. Here is the simple rhyme. 6 is the gate, 1 and 2 is the rate. If baby great, just watch and wait. Let's break it down. 6 day, the active phase of labor, begin at greater than 6 cm dilation or equal to the 6 cm. 1 and 2 is the rate. It means normal progress is at least 1 cm every 2 hours. If baby grades, this means assuring fetal heart rate like category 1 tracing. Just watch and wait. Your action is simply expectant management. This mnemonic also reminds us you when to act. If there is a stall of 4 or 6, it's time to fix. This refers to active phase. Arrest, no cervical change for 4 hours with adequate contractions, or 6 hours, no cervical change with inadequate contraction. So this is time to intervene. So to summarize, for any labor progression question, first, identify the phase. If it is the active phase, 6 cm or more, check the rate of progress and the baby status. If the progress is normal and the baby is happy, eliminate the intervention and choose expectant management. I hope this detailed explanation was helpful. If it was, please hit the like button and subscribe to Mnemonics for more high-yield USMLE content. Thank you for watching.